is your name?
Hi, my name's Jeanette.
What company do you work for, and are there branches located in Arizona?
Yes, I currently work for MD Anderson Cancer Center, and we have affiliations in Arizona where we treat patients.
What is your position title?
I am currently a project manager in the Division of Surgery at MD Anderson.
What are your specific job duties?
So right now, my kind of main focus areas are to support initiatives related to the value equation in healthcare within our division. So basically, that means kind of any initiatives around quality, safety, and cost. So we're looking at a variety of different things to help improve the quality of the care that we provide to our patients. Obviously, keeping them safe and trying to do it at the lowest cost possible for them. So that's mainly kind of my project areas. And then I do some other support work for the division as well.
Do many patients travel to MD Anderson centers from other parts of the world?
Yeah, so I would say probably about maybe 4% of our population at MD Anderson is international. And so we do see a lot of patients from across the world come to seek care at MD Anderson. A lot of them will stay here for many months, as cancer treatment sometimes can take a couple weeks to a couple months to get through a certain cycle of treatment.
So, what type of treatments does your company offer?
So a cancer patient, when they're diagnosed, mainly kind of the three areas that they can go through as far as treatment to treat their cancer would be radiation oncology. So they would get radiation. They could go through surgery, or they could go through chemotherapy. And those are the kind of three main types of treatment that we offer. Some patients may actually go through all three, depending on their level of cancer and where it is. So um, it just kind of depends. We obviously treat everybody for their individual cancers and hopefully treat them and cure them.
Are all clients cared for equally, or do they consider needs and slash or specific characteristics for different groups of clients?
So we are really fortunate at MD Anderson to be able to treat a lot of different patients from all across the world, all different backgrounds, with different languages as well. And so one of the things that's really important in healthcare is to make sure somebody feels comfortable speaking to their doctor, to make sure they understand the treatment that they're going through. And so we definitely treat everybody the same. They're all offered the same treatment. But we want to make sure some people have the ability to talk with their doctors. So we offer things like language assistance. We have interpreters that are there. I think they probably cover almost 20, 25 different languages. And we can also kind of video chat over the phone also if we don't offer the languages in-house. So that's kind of one thing that we do to make sure that all of our patients have access to the right care.
What considerations do you have for serving Hispanic clients?
So Houston is where our main hospital is at MD Anderson, and then also in Arizona, I know there's a sizable Hispanic population, and so again, things like making sure that we offer language patient education website in Spanish is kind of the first and obvious thing that we do. And also, a lot of community outreach. We do that as well. So in different communities to make sure we go to their schools and churches and teach them a lot about prevention and education. Different cultures and different populations may have different exposure to different types of cancers or have maybe cultural beliefs about how to treat certain cancers. And so a lot of our physicians and our nurses will often go out to the communities to talk to certain populations.
So you talked about like certain genetic needs of Hispanic clients. Like, do you know any specific of those like clientele needs based on cancer, or is that more um, for the doctors?
Yeah, I mean, I don't want to speak out of term, but um, I can speak at least here in Houston. Um, we offer services at one of our county hospitals. So we have MD Anderson physicians that provide services at our county hospitals. And sometimes uh, things, and I used to work in the gynecologic cancer area, so that's probably the area I'm more familiar with. So things like cervical cancer sometimes can go undetected for a long time because patients may not be getting their annual pap smears or going to their OB-GYN regularly. So sometimes something where they may not have access to care or um, have barriers to getting kind of annual checkups sometimes can lead to more progressed cancers later. And you see that sometimes in different populations a little bit more just because of kind of socioeconomic or cultural or kind of access to care issues.
I mean, that's a perfect segue into my next question, which is what are the cultural problems, difficulties, or challenges you face when serving Hispanic/Latino clients?
Um, you know, again, I feel like cancer is something that the whole world faces. And so I know MD Anderson is a um, global healthcare provider and really does a lot with kind of our local Hispanic community. You know, the second largest population in Houston is Hispanic, and so it's obviously really important that we um, involve those patients in their care. The other thing that I think is really interesting also is the research that MD Anderson does. And so, again, kind of doing clinical trials or work like that, it's really, really important. And it's a big part of our mission to make sure that, we have patients that are enrolled in clinical trials that also represent kind of our community. And so there are specific efforts, to try to reach out to different areas to make sure we have that population that are willing to work with us on the research side as well.
Mm-hmm. I know that you said earlier that you have interpreters and that you have like special websites that are in Spanish. Are there
Mm-hmm.
anything that the company offers like employees for training with cultural differences?
Yeah, one thing that MD Anderson is doing, we've had a new president kind of within the last year, and one of his really big emphasis is to help develop the leaders within the institution and the managers. And so, um, and one of the kind of top um, kind of focus areas for him and also our division is diversity and inclusion. And obviously, our staff, our doctors, our providers, our nurses, it's a pretty inclusive and diverse group. I think pretty. Actually, he gave a really nice presentation a couple weeks ago. About 60% of our population are women. We have a pretty good sort of breakout of between different races and ethnicities of people that work at MD Anderson. But basically, we offer a lot of training, whether it might be interview training, understanding bias, understanding diversity, kind of understanding people through a different lens. Um, it's really important that we work as a team and have different ideas, and sometimes that diversity of ideas is what makes us kind of be able to move things forward. And so it's definitely been a big emphasis for us this year as an institution and also within our division is to work on diversity and inclusion within our staff and faculty.
Okay, well, thank you for answering my questions, Jeanette.
You're welcome.